All right, so I would like to welcome our presenter today. I'm happy to introduce Rhonda Barkis. She is a program specialist with the National Rural Health Research Center and Rural Health Innovations. Rhonda joined the center in 2012, and she brings experience of over 30 years in hospital settings. She currently works as the project specialist for the Small Rural Hospital Transition Project. Originally, Rhonda worked as a project associate for the Rural Hospital Performance Improvement Project since June of 2010 and developed the Recommendation Adoption Progress, or the RAP reporting process, which focuses primarily on gathering and analyzing outcome data. Rhonda is an independent contractor with Northside Hospital in Atlanta, where she works with leadership teams to improve their effectiveness related to organization-wide goals. She's worked with organizational development and coordinated projects concerning hospital consumer assessment of healthcare providers and systems, also known as HCAPs, employee recruitment and retention, and staff and leadership development. She was previously in private practice and has experience with group, individual, and couples therapy. Rhonda holds a Bachelor of Science in Psychology from Wesleyan College in Macon, Georgia, and a master's degree in psychology from Georgia College. She is currently licensed in Georgia as a professional counselor. So with that, I am going to turn it over to Rhonda.
Okay, thank you so much, Angie. And I really appreciate you all being here this afternoon. And I'm very excited to be talking about this topic because it's something I've worked with for quite a few years. As Angie was saying, prior to coming to work at the center, I had worked in a hospital specifically with leadership and organizational development. And one of the things that was, I think, kind of interesting is, this was in 2007, the hospital had two main strategic goals that were across the entire organization for every unit and every department, whether you were direct patient care or not. And those two goals, one was staff retention, and then the other one was patient satisfaction. And I think that the wisdom of that is the realization that one impacts the other, that we could not really focus on only one of those because they are so tightly bound together. We know that when we have really good staff retention specifically, and I do think specifically of our good employees, when we're able to really retain our good employees and our great employees, that's going to impact our staff or our patient satisfaction. And when we have really good patient care and outcomes and we're really engaged with the patients, we know that that impacts staff satisfaction. So knowing that those two goals needed to be addressed parallel throughout the entire organization, regardless of the unit or the department. So just as a reminder about the center's purpose, of course, we work with sustaining and improving health care in rural communities. Angie shared that I work with the Small Rural Hospital Transition Project, which is with hospitals across the country that are in persistent poverty counties. We focus on these 5 core areas: transition to value and population health, collaboration and partnership, performance improvement, HIT, and of course, workforce. So today we're going to be talking about these 5 main objectives. The first is understanding the importance of employee satisfaction. We're going to talk a little bit about a way to do it. One of the things I've done with the center in this last year is doing some staff satisfaction services for hospitals. And so I'm going to just share with you kind of our thinking about that and how we've done some of that. We're going to talk a little bit on choosing the right survey questions so that we get the richest and the most robust information. And that is going to be so specific and individualized for the organization, depending probably on their mission and their values and what is going on in the hospital at that time. We'll talk a little bit about a couple different ways to administer the survey. And then we're going to focus on that last bullet point, which I think is so important, and that's understanding the importance of survey follow-up and the action steps. You know, I think that it's one thing when an organization does not ask people for their opinion about their satisfaction, but it's almost worse when we ask somebody their opinion and then we do nothing with it. And so that fifth bullet point is really, really critical in closing that loop with staff satisfaction. So we'll come back and talk some about that. So I know that you all have attended a webinar that Kath and Angie did that was called Investing in Retention Strategies for Workforce Engagement. And they specifically were talking about the cost of turnover and the importance of employee satisfaction. So I'm going to revisit a couple of their slides to set the stage for where we're going today. Just the definition, of course, of employee satisfaction, just a reminder that typically it is not just about the money or the fringe benefits. Many times when we ask staff, what would make you more satisfied, they say more money, and we know that money and fringe benefits, there's kind of a foundation of what's expected and what seems fair and what's right and what's enough. But satisfaction really doesn't come from that as much as it comes from that enjoyment of work, fulfillment, gratification, feeling like we do work that matters. And you all know that, and I know that, that yes, the money is important. We need to be able to support our families and have a good quality of life. But satisfaction is really about the work that we do and whether we feel that it's important and we're engaged in that work. So I know that that Angie and Kath had talked a little bit about direct costs of turnover, and these are some of the direct costs of turnover. What's really important, I think, is for us to think about the indirect cost of turnover, because if you think about it, the indirect cost of turnover are actually going to be the same whether it's turnover or whether it's staff unengagement. So some of the indirect costs of staffing unengagement. You know, when we have staff who are not engaged, even if they're staying at the hospital, they're still there. We know that when people are not happy with their work, it's going to impact the quality of care. We know that it impacts the morale of the unit or of the hospital. There's lost productivity. There's increased workload because we have some people working harder than others. There's that whole historical part of the knowledge of the hospital, where we were, where we are going. And then there's that impact on the organizational culture. So again, the indirect costs of turnover are the same, whether it is somebody leaving or whether it's somebody who has already left, but they're still there. You guys probably have heard that old joke about how many of your employees are working, and the answer is, about 20% of them. You know, that's why we should care about employee engagement and employee satisfaction, because if somebody is coming to work but they're not really working and they're not really engaged and they're not satisfied, we know that it's going to impact the rest of the hospital or the organization. And so even if we think, well, they have nowhere else to go, we're in a small community, the market is not really, the job market's not great right now, people don't really have another choice, it really should matter, because again, whether or not they're satisfied is going to impact other things. And so I have here the bad apple effect, which impacts the low morale. We know that when folks come to work and they're not satisfied, they're unhappy, they're more likely to have a bad attitude. They're more likely to be maybe stirring the pot a little bit, creating negativity with their coworkers. They're more likely to spend time doing things that are not about the job, but maybe on Facebook, spending a lot of time socializing, talking to their peers, and not really being engaged in their work. And again, just the complaining that they might do will impact the morale for the rest of the staff. The other thing to think about is if we have somebody who is kind of that bad apple, low morale, low job satisfaction, and they are coming in, they're not very engaged, they're maybe doing the bare minimum to keep their job, they are going to be impacting our really good workers, because the other folks are going to be looking at that person and saying, well, gosh, I'm working so much harder than they are. Look what they're getting away with. Why am I busting my butt to do all of this? And so it sometimes will impact actually the work of other people. The other thing is the clinical errors. If somebody is working in a direct patient care area, if they are not happy at work, they are less likely to really be paying attention to what they're doing, and more likely to make clinical errors. And then the lower patient satisfaction. Patients certainly will pick up on whether staff are happy in their organization or not, whether they're glad to come to work. And that's going to impact patient satisfaction, not only indirectly, but also sometimes directly. I don't know how many times I've heard stories of a patient making complaints because they hear staff out in the hallways Monday mornings at 7 a.m. saying, oh my gosh, I can't believe I have to come back in here again. Oh, this is horrible. And saying bad things to their coworkers about their work and their dissatisfaction. So that's going to impact certainly the patient care and the patient's trust in whether or not they feel that this person's going to be able to take good care of them. And then lastly the absenteeism with folks calling in more, especially on a Monday morning, because they're unhappy with their job. And again, then that's going to impact staff morale for your good folks. So it should matter whether we are the only provider in town, whether we're the only game in town. It matters whether or not people are satisfied. And so as we think about looking at how to actually do some staff satisfaction surveys, I think that initial planning is so important to make sure that we have thought through the process, that we have the right people involved, that we have a realistic timeline. And so I've identified 11 steps that we keep in mind as we're looking at staff satisfaction. The first thing is I think it's really important to identify a project manager. And so that's somebody, it might be somebody from HR, it might be some even rural hospitals have a special project coordinator, but somebody who cares about this topic. I think if someone doesn't care about staff satisfaction, they're of course not the ideal person to be leading the project. So it needs to be somebody who's very invested, who wants to see results, that wants to see outcomes, and hopefully somebody who also has a lot of credibility with staff, because that's going to impact the staff reactions and response to even giving feedback. And of course, other pieces is it's really important to have somebody who is organized, who can meet deadlines, who's a good communicator. So choosing the right project manager for this is important. And it could be, again, somebody at a higher level. It could be a director of a department. So it doesn't have to be necessarily HR. The second kind of general thing to think about is how are we going to administer this? Are we going to use an outside source or not? Now, of course, there are pros and cons of doing an in-house survey versus an outside source. I think certainly one of the pros for doing in-house is it's much less expensive, although doing employee satisfaction doesn't have to be incredibly expensive, but it is less expensive. I think that one of the pros of using an outside administrator, of course, is that those folks maybe have worked with different hospitals or different kinds of industries, and they see trends, they see kind of what are some of the important things to be to be focusing on. They can sometimes see pieces that doing it just in-house might miss. The other thing is I think sometimes staff will be more likely to complete a survey if it's an outside administrator, in that they know that their privacy and their confidentiality is going to be protected a bit more, that the CEO or a director is not going to be looking at the response and going, oh, that's Susie Q from my department. So there's somebody out on the outside who's reporting that. The third item here is to create a timeline and identify the stakeholder groups. 3 stakeholder groups I think are important: the C-suite, the leadership team, and the staff. And the reason we want to identify these folks up front is later, after we do the survey and we're thinking about communicating the results, we're going to have to kind of create communication for the different groups depending on who they are. So, and I'll talk about this later in more detail. But the C-suite, we will share a certain amount of information. Leadership team will hear one thing, staff will hear another. So everybody's not necessarily getting every single detail from the survey, but we're going to have to really create that depending on that team and who needs to hear what, so that we can still protect privacy of other folks who might have filled out the survey. Fourth, we're going to create the survey and the communication to staff. So here, in addition to creating the survey, and again, we'll talk about that in just a moment, I think it's also important to go ahead and decide what is the communication going to be to the staff about it, what is the messaging we want to give, how can we best influence them to want to fill out a survey, and I'll talk about that a little bit later when we talk about how to maximize the response rate on this. But I think it's helpful to go ahead and have a plan for the communication, who's going to do it, how often, when are we going to do reminders, have all of that detailed as part of that timeline and that plan. Then, of course, we're going to disseminate the survey, and that's going to include also letting staff know what the deadline is for filling it out. We're going to, this is going to include doing the reminders during the dissemination survey process, so maybe a week into it, reminding staff, hey, this is out there, we'd love your feedback. Another week later, reminding them once more. I think that there's kind of a sweet spot in how long we're even going to leave the survey open to get results. I think 2 to 3 weeks is kind of the sweet spot, because 2 weeks to 3 weeks really allows for anybody who was on vacation or maybe was out a few days and they were sick. They're still going to hear about the survey. They're going to be able to fill out the survey. So we're going to capture most staff. I think that if we leave it open very much longer, it loses its sense of this is important, we really want this feedback, and the longer we leave it open, I just think that people become less interested in it and are less engaged in even filling it out. Doing 2 to 3 weeks tells people this is important, we're going to move on this, and we want your feedback so we can move forward. One of the hospitals we did a survey with, we had it open for 3 weeks, and they had about a 68% response rate, which was really pretty good, and wanted to leave it open another week, so a 4th week, to see if we could get a few more responses. And it was interesting, that last fourth week, we got no more responses at all. So it seems like 3 weeks was really kind of it. Then 6th, of course, we're going to compile the survey results in a very readable, understandable way, and I'll talk a little bit about that in just a moment. And then we're going to share the results with the C-suite. I do think that the CEO especially needs to hear the results first. And when we talk about communication, we'll go into more detail, but I think that the C-suite needs to get the results of the survey first, And then that group begins to think about an initial action plan. Now that we have these results, what are we going to do with them? It doesn't need to be the final action plan, but it needs to be some initial action plan that can then be presented to the rest of the leadership, which is then the ninth step, which is to share the results with the leadership. This would be the managers, directors, supervisors for the different departments. Share that initial action plan and maybe work with these folks either as a group collectively or individually, depending on what the issues are, to finalize the action plan. And then after the action plan is completed, then we go to the staff, share the results with the staff, identify the relevant action items to let them know what's going to be happening next, what's going to be worked on. And then lastly, we are going to create a process for those next steps and continued communication. And as I said earlier, I think that that is critical because it tells people, yes, we're taking this seriously, yes, we care about this, or no, this was just a task we did to say that we did it. All right, so survey development. Two main ways to do it, electronic and paper. I'm not sure that many people do use paper anymore unless it's for a small group. Of course, for a few reasons, it's hard to maintain privacy and confidentiality if somebody's able to recognize somebody else's handwriting. The other part, of course, is as we pull the results together, that would be really, really time-intensive, labor-intensive to have to go through a lot of paper surveys. I did work for an organization a few years ago, and we used to do some staff satisfaction for hospitals, and we did it by hand, and it was quite a lot of time just pulling that information together. So the other option, of course, is electronic, and that is, you know, whether we're doing it within the organization or getting somebody outside to do it. There's so many opportunities to use electronic surveys. We've used SurveyMonkey. It was easy to format and to create the survey in SurveyMonkey. It was easy to administer. And then the other nice thing, of course, if you've ever used it, is it will compile the results and at least provide some beginning drafts of tables and graphs that will show your results and your outcomes. Then the next, after we've decided whether we're doing electronic or paper, I think we have to figure out what are some of the broad areas we want to survey. There are 5 that we'll talk about in just a moment. So what are the big general areas? Not the specific questions, but just the general areas. Again, this is going to depend on the type of organization. If it's a hospital, if it's a clinic, if it's another kind of organization, we may want to know different kinds of things depending on that organization. Then we're going to create a template of survey questions. I think it's helpful to do our research, even if we're creating a survey on our own. Go out there, start doing research on different surveys. Maybe think about places you've worked and what some of the questions were on those surveys. What did you find helpful? What did you find not helpful? And begin to create a nice big menu or template of different items. And then once you have a template of items, then you can go through and choose the most relevant survey questions. And especially if you are supporting an organization or a hospital in doing employee satisfaction, I think it's helpful for them to be able to have a list of questions to respond to and to say, yes, that's a good one, we need to keep that one, no, that one doesn't really fit us, that's not relevant. Or sometimes they'll see an item and they'll say, oh, you know what, that's a good item, but you know what, in addition, we need this item. And so it could spark other ideas, but I think it's helpful for people to at least have something to respond to first. And then once we've chosen the most relevant survey questions, then we can wordsmith that as needed to suit an organization's culture. And I'll share with you guys in a moment how how I've done that before. So these are the 5 topics that I've used with staff satisfaction. The first is overall satisfaction. This refers to the overall satisfaction for that staff member with their organization as an organization. So this is things like their reputation of the organization, how they feel about upper leadership, how they feel about the direction the organization is going. And the second bullet point, which is another general topic area, is workplace environment and culture. This specifically refers to how that person feels about the department they work in. So not the hospital organization, but their department, their coworkers, the work that they do, their supervisor, that day-to-day kind of thing that they deal with. Third group or area is onboarding and opportunities for growth. So, you know, do they have a mentor? What was their orientation process like? You all might know that most data says that within 2 to 3 weeks, most staff are making a decision whether or not they're going to stay in an organization. And this speaks, I think, to the importance of a good onboarding and orientation and mentorship process. Fourth is the salary and benefits, and then a fifth area is more the open-ended additional comments. What do people like the most about working in that organization? Those kinds of things. So here's an example of some of the items that you might use, and these, again, this is just a few suggestions. So this is for overall satisfaction of the hospital. So this would be looking at, again, the whether they believe that quality is the top priority for this hospital, whether they feel like they contribute to the mission and future plans, whether they feel like they know the plan for the hospital ongoing, do they have confidence in leadership, whether they feel like senior leadership's a role model. One of the questions, I think that fifth bullet point there is so important, and I think if I were to ask somebody one question, this would be the question I would ask them, whether or not they would recommend employment at this hospital to their friends and family. I think that question tells so much, because if, you know, we certainly would imagine that if it is, if this is a place I like working, then I'm going to encourage other people to apply to this organization. If I don't think it's a good place to work, then I'm not going to be encouraging my best friend to come here because it's just not a good environment. So I think that question is really very important. When we were working with a hospital in the past, they took that question, and this is one of the ways we individualized the survey for them. They took that question and they said, you know, if a staff member says no, they would not recommend employment at this hospital. The hospital asked us if we could then do kind of a text box below that. And so if they say no, they would not recommend employment, then we just ask them, tell us a little bit about why you say that. And I'll tell you, the comments were very telling, and that really gave this organization some great feedback about specific concerns and issues with certain departments or certain areas or certain managers. So that was, I think that was a nice way to individualize. Around workplace environment and culture, again, some sample questions. These are around the sense of pride and accomplishment, the work I do, how we care for our patients, whether there's consistency among departments in policy and procedure. So whether people feel like they're being treated fairly, whether they feel like we deal with conflict in our departments, whether I feel like my supervisor recognizes me and appreciates me, but also lets me know when I need to do better work. Whether the workload in the department is evenly and fairly distributed. So again, just some questions on workplace environment. the question, that second question there, we do a good job showing patients we care about them and their needs. One of the hospitals I worked with, they were really looking at patient care, patient experience, patient satisfaction. And so they used this as one of the individualized items. So once they asked this question, if a staff member said, no, we don't do a good job showing patients we care about them, then again, the hospital just asked for more information about that, and they found out information about different patients being treated differently based on a lot of different variables. So just an example of how really, if we don't see this just as a task and we dig down into some of the items that are most important to us, we can get some great information. Onboarding opportunities for growth, again, sample questions. And I don't have it up here, but another question might be I know a lot of hospitals do mentor programs. How helpful was that? So looking at whether folks received the orientation they needed, the performance feedback process there, whether they feel like they're going to be able to grow within this organization, which is really going to give you a lot of information about their sense of retention and whether they feel this is an organization they can continue to grow with. Salary and benefits, lots of items here, and again, hospitals or organizations are going to individualize this based on probably what benefits they offer, or even just bundling some of this. If it seems like we're getting too many questions, then maybe just bundle several of those items into benefits package, for instance. And then as you're looking at your items, the other thing to think about, of course, is how are you going to score the items? And I am always a big believer in keeping things as simple as possible. And so for easy comparison, I really encourage finding a consistent scoring key which can be used for every item. And so once we developed our scoring key, we also then looked at how we needed to wordsmith some of our items to fit this so that we could get scores from a 1 to a 5, from strongly disagree to strongly agree. The higher the number, the strongly agree, was associated with higher staff satisfaction. But it was much easier than as we were looking at trends and as we were looking at some of the graphs, if everything was using the same key. The other thing I want to talk about is analyzing the open-ended questions, because again, these can be very helpful in telling. And I will say that this part was a bit labor-intensive, although I'm sure some people who are very techno-savvy could probably figure out an easier way to do this than I did. But for the open-ended questions, I created kind of a key with categories. And so as I got back the different open-ended questions, such as the question about why you would, whether you would recommend employment to your friends or family. And if the person said, no, I would not, then we asked for the open-ended questions. And then once I started getting those back, I really took a look at the main categories that I was seeing. And so then I went through and actually by hand looked at each open-ended question and categorized it according to a certain category. And I actually color-coded it to make it easier. So in general, some of the categories, an issue with leadership, issue with their coworkers, the personal work satisfaction. So again, just developing categories for the open-ended questions based on what I was seeing. Again, color-coded that so that I could very quickly and easily see which ones were falling out with the most items. And if something fell into more than one category, I categorized them in both items or in both categories. But this was just an easier way also as I prepared to present the findings to the hospital. All right, so we've created our survey. We have gathered the results. we have closed the survey now, and I'm ready to pull all of those findings together and then report the results. And so how I did that really, I think, again, is based on those stakeholder groups. For the C-suite, I shared everything with them without any censor at all. And I will say that sometimes there are some negative comments. There are people that are named. But I didn't feel like it was my place to censor any of that. And in fact, and one thing that we saw also was some people, whether on purpose or not, they typed their answer using all capital letters. And so when I reported it to the C-suite, I left it in capital letters. And somebody said to me, well, it looks like you're yelling at them. And it's like, well, I don't want to make any assumptions about whether that staff member was really, really angry or not. So I just shared it as it was. With the leadership team, the results for those, it was much more kind of a general. So I shared with them the 3 highest scores, the 3 lowest scores. They saw all of the scores as far as the graphs, but I really focused on what are the top 3, the lowest 3, and then provided some general information for them around those open-ended categories. So more general, like, out of 42 responses about what people liked most about the hospital, 38 responses had to do with their coworkers, something like that. So kind of more about the general trends that I was seeing. Shared a few examples of some verbatims, but certainly was very careful about which verbatims I shared because, as I said, there were some negative comments about certain leaders. I left that to the C-suite to decide whether they were going to share that with those specific leaders, and I think that was the plan, that they would do that, but they would do that one-on-one with them, not, of course, to the whole leadership group. And then with the staff, share pretty much the same information. Let them know what the scores were. Let them know the top 3, the lowest 3, with the exception of the comments that would refer to a specific leader. And here's an example of this was like a page in a PowerPoint for overall satisfaction with the hospital as an organization. You can see I just identified the top 3 areas of satisfaction with the score out of a possible 5, and then the top 3 areas of improvement. When we talk about the top 3 areas of improvement, also I tried to put that in perspective for folks, because if you look, their lowest scoring item was 3.7, and I think sometimes we see lowest scoring items and we see, oh, senior leadership's a role model for hospital values and standards. Think, oh my gosh, this is horrible. But if you think about it on a 5-point scale, 3.7, even still, as a lowest scoring item, was not that horrible. And so just reminding people to put all of this in perspective. Now, certainly if it's anywhere below a 3, 2.5, then there's much more concern. And yes, we're going to do something about these items, but we need to keep it in perspective. And then also, as part of the presentation, it included the scores for each of the items that were discussed in the hospital as an organization. And then this is the way that I just summarized the open-ended question about whether somebody would recommend employment. 48 responses were received, and then you can see where I identified how many comments fell into different areas, whether it was leadership concern, coworker concern, or an issue around their benefits. Developing and communicating the action plan. I think that, so, we talked a little bit about using the findings, develop the action plan, targeting those priority areas, sharing the communication strategy with senior leadership and your department leaders. I think the messaging from the senior leadership really needs to focus on those overall results, current actions, and the planned actions. And then as we're even sharing this with the leadership and also with staff, we really need to keep tying the results into the hospital mission and values, because that's what's really important. This is about the hospital mission and values, or organization's mission and values. And we need to be able to align that staff satisfaction with the mission and the values of the hospital or the organization. Also, I think it's important to start off by talking about the strengths first and then the opportunities for improvement. And I think wording is important. It's also important to use wording such as areas for development, areas for focus, areas for improvement. And then the messaging from the department leadership, though, needs to be focused more on what's being done as an organization, what the department leaders are going to do, and then what is that team or the department or the staff going to do. So this needs to be shared with staff as they're driving down the communication about the survey results. And then a couple last additional recommendations. One would be to, once we have these results, once we've shared the results with the different stakeholder groups, we've created an action plan, then we need to start really figuring out, okay, what are we going to do with this information to move forward? And so one option is to establish trainings for staff, including executive and management teams, to focus on the areas of improvement. Several years ago, when I worked in the hospital, there was a book that was written by Marcus Buckingham with the Gallup organization called First Break All the Rules. And the book had just come out. The Gallup organization wasn't doing anything with this as far as staff satisfaction. They had just done a lot of research on what really was associated with staff satisfaction. They came up with 12 questions that they said statistically across different organizations with different industries are most associated with staff satisfaction. So I encourage you to read that book. Again, it's First Break All the Rules by Marcus Buckingham. And they came up with 12 questions that they thought were most important. And so the hospital I worked in, we're like, hey, let's use these 12 questions as our staff satisfaction survey results. We did that with some great success, and then we even created trainings for our leadership based on those 12 questions so that leaders could learn ways to improve their performance and to improve staff satisfaction around those 12 items. So we did that for a while until we found out we were breaking copyright laws and were asked to stop. So we didn't do that anymore, but it was very helpful and it was very impactful, I think. And just as a note, I think this is kind of interesting. What Gallup found as the #1 question most associated with staff retention and satisfaction is this question, I have a best friend at work. And it's funny, they talked about how they did a lot of research, whether if they asked, I have a good friend at work or I have a friend at work, the item, though, it had to be really phrased that way, I have a best friend at work. They found that most associated with retention because if somebody could say yes, then they were much less likely to have a bad day and just quit because they had their best friend there at work. So that was just kind of interesting, and I think a little tidbit for folks as they're thinking about looking at staff retention. The other item here that I think is so important, and I really encourage folks to do, is that second bullet point. Consider creating a staff satisfaction team and include key staff members. I think that if an organization is able to pull these results together, begin creating their action items, and then actually create a team utilizing frontline staff, that is very powerful. Because if you have some frontline staff that are involved in improving satisfaction, they are going to be more engaged, and they are going to, number one, it tells them that their opinion is important, but it also is a way to make sure that it stays a priority for staff. They're going to want it to succeed if they're involved in it. And also, you guys know that frontline staff often have some of the best ideas of what needs to happen or what can happen. I think it's also, this is a great opportunity. I've seen hospitals do this or organizations do this, where they pick folks that they are wanting to groom for future leadership roles, and they include them in this group or this committee because it's a way for them to start working with leadership and upper leadership on a big organization-wide project. And so it's a great grooming opportunity for them. And then a couple other recommendations is to look at annual staff satisfaction surveys just on an ongoing basis, and to be able to identify issues and interventions early. If we do this every 5 years, sometimes things can really fester, and we want to catch things as quickly as possible. And then we can also use our survey items as a baseline moving forward to see whether we're making any changes or any progress on our action items. And then a couple comments about increasing the survey response rate. Communicating in advance to the staff about the survey. Let them know it's coming. Let them know when it's going to be rolled out. Let them know how the information is going to be used. I think the second point is also very important. It's let them know the limits or not limits of the confidentiality. I always felt that was very important to let folks know that, you know, your identity will in no way be identified. It's totally confidential because people are afraid to fill this out. They're afraid to be honest. They're afraid that there may be some retaliation or backlash. So staff need to know that their privacy is going to be protected. And again, provide 2 to 3 weeks for the survey completion, and then send periodic reminders to staff regarding completion deadlines. Okay, and so I am going to hand it back over to Angie, and we can open it up if anybody has any questions.
Thank you, Rhonda. Yeah, so does anyone have any questions for Rhonda? You can use the chat box or unmute your phone line. Any questions, or anyone want to share anything about a survey, employee survey process that you've been a part of?
Oh, that's a good point. Thank you, Angie. That's a great question. There's so many ways to do this.
Hey, Rhonda, this is Cap.
Hi, Cap.
Hi. Hey, you know, one of the things that I really caught my attention, and for everybody, it won't be a surprise I'm thinking of it this way, but I just wanted to highlight that I think it's so important, is that when the employee satisfaction survey is being thought of or designed, the 2 points that you really made that I think are so critical is that, one, it merges the idea of both that those strategies of improving the patient satisfaction and the employee satisfaction is so intertwined, and in that regard, so is that those steps that you talked about of onboarding being so part of this whole equation, and the way that people perceive their work. But really the point I wanted to make was that it's also really important to have this planning be part of, or this employee satisfaction work be a part of what that meets that mission and vision of the organization itself, that it's not done in its own small black box. It's done as a connection to everything else that's going on in that organization, no matter if it's a healthcare organization or a network. Even if you're doing a satisfaction check-in with your own staff, it still has to be all connected to the work that the organization is doing. So I don't know, you could expand on that if you want to, but I was super excited about having you bring that up to the forefront.
No, I think that's a really good point, and it reminds us of doing this with intention, and that the survey should not be just a task that we check off our list because we're supposed to do it or somebody says it's a good idea. It really needs to be done with intention.
And a quick little follow-up. Rhonda, did you mention kind of the frequency of doing employee satisfaction surveys? Any thoughts on that?
You know, I think no more frequently than once a year. A lot of places will do it every other year so that there is time to really implement the action plan. I think part of it probably depends on the if it's a team that's involved and they have really worked very hard to implement some action items, and after 12 months or 18 months want to go ahead and do another survey to see if there's some movement on that, I think that would be fine. I think about 2 years for a lot of organizations is pretty normal.
This is Angie, and I would tag on to that and saying that I've also heard of some hospitals who, like you said, Rhonda, do it annually or every 2 years, but in the interim, at the departmental level, supervisors may do like quarterly, what they call rounding, so just kind of fairly informal touch bases with employees in a department to just kind of keep tabs on the culture and the feel of the departments and stay ahead of anything festering into anything too big in between the big annual employee satisfaction survey.
Yeah, that's a really good point, and that can also be a really good action item on the plan between surveys. That's doing those touch base meetings with staff, doing staff forums. This is another way to keep your finger on that pulse.
Well, I switched screens to our evaluation questions. I would invite anyone who hasn't asked a question yet, if you have one, to feel free to go ahead and unmute and ask while we're completing the survey. I'm going to quickly touch on upcoming events. The end of January, we'll start our next round of TA check-in calls. February 14th is our next gathering. It's a peer group call on distance education exploration. And then February 27th through March 1st, of course, is the Community-Based Division All-Program meeting in Rockville, Maryland. I also wanted to, I don't know, Marcia, if you are dialed in or just on your computer, but wanted to open up the mic if you had anything you wanted to share or update the group with. Looks like Marcia is typing. And I'm getting an echo. I hope you all are not getting that same echo from me.
It sounds good to me.
Okay, great. As long as I have you you all on the line, I'll just give you a quick heads up that I will be sending out some communication to you tomorrow morning about the all-program meeting. There will be a session on March 1st that is specifically for the Allied Health Network. And so we've got a couple hours that morning to be together. And so I'll be sending out an email communication to you all with some instructions for some of the activities that will take place during that morning. So if you have any questions once you receive the email, certainly reach out to me and let me know. Marcia says, please just submit your grantee files, green slides. And then during our TA check-in calls, I have sent out reminder emails to several of you, but for the most part, we'll be taking a look at your sustainability plan deliverable progress and answer some questions around that, and then our normal project updates. Any final thoughts from anyone?
This is Cap. I can't help myself just before we get off. I just wanted to thank Rhonda, but really make the point with everybody here that even though this satisfaction survey work that Rhonda has been presenting is really healthcare organization oriented, it's so generalizable to all organizations. So if you are partners with other kinds of health providers in a hospital, they're going to be interested in this kind of work and should be, and so is your education partners and even some of the agencies like nonprofit agencies that you work with. So really encourage you to think about how you as a network can use this knowledge to maybe even create a new service or a way of supporting your members inside of their organizations to be stronger and more robust organizations to help with all of the staffing and engagement. So just wanted to make that plug. Thank you, Rhonda.
My pleasure.
Great
Thank
point.
you.